Hello everybody, this is the NPR radio communication. How are you everybody? Today is time to talk in English just to explain the new course we are starting in April just for physiotherapists, only physiotherapists and rehabilitation people. That means osteopaths, physiotherapists and rehabilitators. That is the new course we will have started now in April. And today we have the case to explain to you what is the course and why you have to do that. This is our social networks. You can follow us in the social networks, and this is the course we will start. And we will start in the month of April, and the registration is open today. Okay. We will start now just talking regarding the how to have a very good rehabilitation, how to perform a physical rehabilitation without recidivis. This is the important thing we have to talk today. This is the course. You have all the details there, and you are interested, you only have to contact us and register just to start the course. Without that will be a course in English language, will be only an online course, just totally online course, not physical, just totally online course. Okay, welcome to the NPR family. We are a school with an international school. We have all around the world branches, and we teach for every single people of the medical sciences. So we teach for doctors, we teach for dentists, for physiotherapists, osteopaths. That is interdisciplinary school, and this case is just only for this directed to physiotherapist and osteopath and rehabilitation people. Look at that. Who has had a patient like this? That's very important. Who has had a patient like this? If you see that patient, you means that he has a short leg, a short arm, sorry. The arm shorter than the other, the right one shorter than the other. But that is not true. If you put two single cotton rolls in the mouth, you see how the arms extend. That is why, because this is we are annulating the negative effect of stomatognatic system. Imagine that I am telling you in your physical rehabilitation, when stomatognatic system, that is not TMJs, is a stomatognatic system is disturbing your muscle chain. That's very important to understand. And also that, look at that patient who has a physical problem. Obviously, if she are going to the physiotherapist, obviously physiotherapist or osteopath is working. But look at that, oculomotor system is disturbing, and the mouth is disturbing. And how do we treat it? That is, we have to think about that. How do we treat her? And the same here, look at the same patient. Teeth problem, tongue problem, eyes problem, physical problem, and neurological interferences of the systems. Who have to begin? And obviously also, if she has a real short leg, an anatomical problem, what do we do? It's a big question, but we do rehabilitation, but the rehabilitation will be forever. We have not relapses. I think so. We have. Look at that, childs or young people who has real scoliosis. All of them, in all around the world, follow the same path. Pain, follow different specialists like this, and after that the lady or the man is coming back home with the same pain, and the doctor say, in my point of view, she is okay. That's why, because we treat her just in our point of view. That happened because everybody of us treat the patient in the way we know. And if you see the picture there, body, it is all together. The body is a unit. We cannot divide the body. Body imbalance is when we have the mind, the structure, and the biochemistry, and how we can do good rehabilitation if we don't take care of it. It's impossible, and that is not new, because Professor Muzzi talked regarding that in 1936, regarding the connection between the stomatognatic system and the rest of the body. He was talking, he's an Italian professor, was the dentist of the king in Italy many years ago, and he was talking regarding that. We have different clinical things that we can observe, and when we have the jaw changing the position, it will affect the muscle change. It will affect this joint. We cannot treat only the joint. It is impossible to treat only the joint. The joint, the temporomandibular joint, has part of a system. We call that craniofacial system, and we call in our school craniofacial and cervical and postural system, because it's connecting the whole body. That we cannot treat only one part of the body. No, we have to understand when the system is not working and how to treat it. We have to study that, but we have to study that and the other things, not only that. The jaw, when it's changing the position, it will affect muscle change. That's very important. Look at that. That is a missure. If you see that, a lateral deviation of the jaw, how is overloading the body weight. And this is an instrument for measure. When we have dysfunction, the cause is not only one. We have craniofacial system is not working, the foot support, the biochemistry, the eyes, the oculomotor system, and etc., etc. How we can do good rehabilitation, any technique we will use, how we can have a good result if we don't treat the cause of the problem. It is impossible. Impossible. I can show you a lot of patients with this problem. Postural problems, that they have a lot of symptomatology, headaches, neck pain, diffuse pain, muscle pains, etc., etc., etc. And the eyes are affecting, and that is affecting the mouth also. The teeth, they are affected. The teeth are affected, and all of them, it will affect the posture. It will affect the posture. And if we can measure that, we can see how the occlusion is affecting the posture. I will show you that here. Look at that. Measure with an instrument the things we're doing. When we close the mouth, how the mouth closing affect the posture. But we have always in the whole postural problems and physical problems, we had mainly involved craniofacial system, oculomotor system, foot support, biochemistry. Look at that man. It was making a lot of surgeries because he has pain. They start from the lower and started every 2 years one surgery. That is not correct. We have to understand that we have to change our point of view how to see the patient. Look at that functional scoliosis in young people. We have young people, we have elderly people, all of them, if you see the pictures, all of them, they have involved the whole body. And we cannot treat only one part, or we cannot do just the rehabilitation. You are physiotherapists and are osteopath and rehabilitators. You cannot have a good result, permanent result, if you don't treat all together. And biochemistry also, alimentation, mouth and alimentation, eyes, mouth, foot support, scoliosis. And I can show you a lot of people who have, look at that, occlusal problem, oculomotor system altered. Occlusal problem, oculomotor system is altered. Always we have a problem in the mouth. We have alteration in one of the main receivers of the posture. And that's very important to understand, very important. As we can repeat every single moment, we will find that. We will find this problem. In that age, we can prevent the situation. In that age, treating with the good treatment, the craniofacial system, the food, the alimentation, and doing a good physical rehabilitation, we don't will arrive at this situation in an adult. This situation in an adult who has all this problem that the child before, but now is very late. Now we have to treat her. But the main goal is to prevent this situation in the child, not arrive to the elderly age and then we have to do only symptomatic treatment sometimes, and we cannot resolve the whole problem. That is important to understand. It's important to understand that we cannot have rehabilitation, a good rehabilitation, if we don't have a good treatment in the whole body. That's very important. Physical rehabilitation more effective. That is we are follow physical rehabilitation more effective. When we understand that all the techniques, just techniques of physical rehabilitation, like a physiotherapist or an osteopath, or different techniques, it will work very well. It will work 100%, and it will work for a long time without recidivas, without relapses. That is not the technique. It is important to take it out, the things who are disturbing. And when you do that, the rehabilitation is easy and permanent. Easy and permanent. That is the goal, easy and permanent, because we are taking all the things who are disturbing our body, and then our rehabilitation is better and more effective. Think about that, because that is very important. We cannot do only a physical rehabilitation. Any technique we use, even if it's physiotherapist, osteopath, even we are doing that, is better if we do a good treatment, a good interdisciplinary treatment, and a good holistic treatment. That is the goal. That is the goal we are founding. You have there the emails. If you want to do the course, you can learn how to treat, how to avoid the interferences of the system. I hope you understood that, and I hope I will have a lot of people doing the courses online. It will be an online course, just an online course. We don't do practice in place, just online is 4 sessions online, and I hope I will see you in this month doing this lecture. Bye bye everybody, and I hope you enjoy the Easter and stay together at home. Bye bye everybody.